Hello everyone, I'm Dr. Ann Gillies, and I want to talk today about a comment that Derek Sloan, who is running for the leadership of the Conservative Party of Canada, made this week. He stated that conversion therapy bans would be abusive to children. And I want to say I completely agree with him. Science does not support the notion that gender identity is either innate nor immutable. It's based on a person's belief. Sex is not a belief. It is an objective and scientifically demonstrable reality. Recently, in the United Kingdom, treatment for gender dysphoria has come under critique. Britain's National Health Service has set in motion a review of puberty-blocking drugs and the rules around treatments pertaining to when youth are transitioning their gender. This came in the wake of the resignation of 35 psychologists from the Tavistock Gender Clinic in 2019. They resigned due to the concerns they had of utilizing gender-affirming treatments and medications too quickly. One's sense of self and one's desire to present as the opposite sex has no bearing on objective biological reality. The understanding of sexual orientation is based on sex, not gender identity. And the World Professional Association for Transgender Health has stated that there have been no controlled clinical trials of any hormone regime that have been conducted to evaluate the safety and efficacy in physical transitioning. No controlled clinical trials. This is an experiment, a medical experiment on your children. There is insufficient evidence that any phase of treatment has been helpful. That's from the Transgender Institute. Dr. Ann Lawrence, herself a transgender, has argued that body identity disorder is when a person identifies as disabled and feels that they are trapped in a fully functioning body, that it parallels gender dysphoria. And I totally agree. I've talked on this before in different presentations. The mindset is exactly the same. And Dr. Josephson has described the phenomena of gender identity and gender dysphoria as a delusion to a fixed false belief which is held despite clear evidence to the contrary. And most of the people listening right now will understand this, that a girl has a girl's biological body and a boy is biologically male. No other health issues where doctors modify healthy bodies to align with a mind's perception, their thoughts, their ideology, and then call a healthy body a birth defect instead of working with the mind to accept the bodily reality. It doesn't happen in any other realm except with gender identity, gender dysphoria, the transgender. When treatment is focused on helping patients align their subjective gender identity with objective biological sex using a normal counseling method such as talk therapy, gender dysphoria has been significantly reduced. Hanes Inc. is a company that's focused on unbiased, evidence-based assessments of health technologies and clinical programs to determine the impact of patient safety. The quality of evidence for hormone treatment that they gave was the lowest possible rating. Prevalence of suicide attempts are not reduced by hormone therapy. Gender dysphoric children subjectively feel they are the opposite sex, and it's based on what they think it's like to be the opposite sex. Do you know what it's like to be a male if you're female? Or you men, do you know what it's like to be a woman? Of course not. Other than in this area, children who have persistent beliefs that do not conform with reality are not encouraged to persist in those beliefs. This is the only area we see this happening. And some persons, through all the stages, may report satisfaction, even up and after surgery. But they still suffer from the same morbidities and experience startling high levels of suicide. Progression from affirmation to surgery is increasing psychological problems, not decreasing them. Evidence is insufficient to suggest that steps along the way are safe and efficacious. So if they aren't safe, this is an experiment on our children. We would neither affirm a person who believed they were disabled when they have a fully functioning body, nor would we suggest surgeries to disable such a person to conform to their beliefs, which is what is happening to young people. Young women, healthy young women, are having double mastectomies, removing healthy breasts to conform with an ideology. This is child abuse. If something conflicts with our understanding of biological facts, it's inconsistently applied, and it defies common sense that we should demand more evidence. We need to demand more evidence. If something conflicts with our understanding of biological fact and is inconsistently applied and defies common sense, we should be demanding more evidence. We must demand more evidence, and we must stop the abusive practices within our psychological and medical societies to harm children. Thank you, Derek Sloan. Thank you for standing up when psychologists, psychiatrists, mental health workers, and medical doctors are too intimidated to do so. And thank you for listening.